Hi, my name is Joseph. This is the second corresponding video for the weight bias assignment, and in this video we're going to go over the case study that has to do with Shawn Callahan. This patient presents with Crohn's disease, just had a loop ileostomy, and is currently in post-op with a temporary stoma. Just like in the previous video, we're going to go over if there's any weight bias present in the case study and who is demonstrating that weight bias. Then we're going to go over ways that we can address that weight bias and any recommendations we have for that individual. And then finally, we're going to wrap up by talking about how we would counsel the patient and things that we'd like to focus on during counseling. So in this case study, I didn't find any evidence of weight bias, and there are two reasons why I think that I didn't find any. The first one is that the patient has been diagnosed with Crohn's disease. They got diagnosed when they were 19. They're currently 45. So this isn't a patient coming in that isn't diagnosed. It is known that the patient has Crohn's. Second, the patient was referred by a specialist to this hospital. Come on, we gotta nail this. 1, 2, 3, action. However, I would still like to go over an example of what weight bias would look like when it comes to a patient that presents with Crohn's. And one example would be the use of BMI. Patients that present with Crohn's disease often look malnourished due to the malabsorption. And so if a doctor looks at the BMI and the BMI is associated with a healthy person or a person with obesity, then the doctor might attribute that the symptoms that they present with, whether it's irritable bowel syndrome, inflammation, or soreness of joints, and associate that with the weight of the patient. So then how would we address weight bias in terms of a doctor using BMI? Well, this would still be a one-on-one conversation, just like in the previous video. However, we would focus on clinical evidence instead of using BMI as an indicator. What I mean by that is that we should look at what the patient presents with. So if a patient does present with some of the things that I mentioned before, such as irritable bowel syndrome, inflammation, or sore joints, we should still take into consideration that that patient might have Crohn's disease. There is an article on PubMed titled Assessing the Prevalence and Impact of Obesity Among Individuals with Crohn's Disease. In that article, they talk about something called obesity paradox, which is essentially what I just covered when a doctor uses BMI and sees that maybe the patient presents as healthy or a person with obesity and will associate inflammation, IBS, or sore joints with weight instead of thinking about the possibility that the patient might have Crohn's disease. And finally, we move to counseling. So when we go to visit this patient, they are post-op, so we really want to ask some questions in terms of trying to gauge how they feel about the surgery and also how they feel about having a temporary stoma. This patient has had surgeries associated with their Crohn's disease before, but has never had a temporary stoma. So we really want to see how they feel about it. What questions do they have about upkeep, maintenance, or foods that they can have while having the temporary stoma? Which brings me to the two focuses I have. I want to focus on the patient's recovery, and I want to focus on foods that they can intake with the temporary stoma. As far as recovery goes, we really want to make sure that the patient stays hydrated and has balanced electrolytes. They need to take roughly 64 to 80 ounces of water per day. And we also are looking at small meals that are eaten frequently throughout the day. So smaller meals more frequently. And we want to focus on easy to digest carbohydrates, lean proteins, and smooth nut butters. Anything that the patient can intake easily and can be broken down easily. We also want to focus on avoiding highly processed foods and excessive or artificial sugars. And we also want to ensure that the diet that they have is low sodium. An example of a diet that we could give is something like a brat diet. And that's it. Thank you very much.